There are different scopes in phlebotomy, and I feel like we don't talk about this enough. So let's take the time to break down all these different type of titles and what you do in the field as a phlebotomist. First off, what is a phlebotomist? It's someone who collects blood. That's what you do. Is that your main job? No, that is not. Is that the only thing that you do? No, it is not. There's more to your scope of practice. And this is why we're going to break down the different things. So, when you get out of school, after you've taken like a 1 week program, 2, 3, 4, 5 month, whatever it is, you get out of school, you take your exam, your national exam. Some states do not require a national exam. So why do you take it, you ask? Because it gets you inside of that door. Okay? So when they see that you are certified by so and so organization, they're like, "Ooh, you took that extra step. You didn't just stop at getting a certification of completion of just a course. You took that extra step to become certified in what you do." Now, after you become certified, of course, you don't have any experience, but if you had an extra insight, you can place that onto your resume and let them know, "Hey, I did go somewhere. I have some type of experience. Can you give me a chance to show you that I have experience?" All right. Here is what I always recommend for my students: go to places that do not require you to have any type of experience. Why? Because they're going to train you on the job. Those places are: one, donor centers, so that's blood centers; two, dialysis centers for kidney patients; three, you have apheresis; four, plasma centers. Take note of this, pause it, make it make sense. Okay? Again, you have blood centers, plasma centers, apheresis, and dialysis. These places do not require any type of experience. So, when you go into a blood center, your title will be a donor specialist. You're still a phlebotomist. You're It's just a whole process of how you're receiving a specimen. With plasma, again, you're still a phlebotomist. It's just a whole different system that you're using and how you're receiving the specimen. Dialysis, you're a phlebotomist, but after a certain amount of months, you take your exam and then you become a dialysis technician. You see how we shifted? So we started off as a phlebotomist, then we made a shift. Okay? Now, that does not mean that you do not apply. That does not mean that you do not apply at hospitals or outpatients, clinics, doctor's offices. That does not mean that. You can definitely apply for a hospital. But most hospitals require at least 3 to 6 months of experience. Now, if you did your extern at that hospital, that's a little bit easier to get in because they trained you. You know, you did your little do my little clinical with y'all. But some outpatients like Quest or LabCorp, they would like for you to have experience. And if they hire you on a spot, beautiful. But like I said, most places require at least 3 to 6 months of experience. Now, let's say we've got our experience and I don't want to work in a hospital anymore. I don't want to work at LabCorp or Quest. I feel like I want to make my own money. Okay, let's. That's a whole different ball game. You have some experience. You know what type of patients is out there. You know how to look at veins. You know how to do it on your own. Why not upscale it to mobile phlebotomy? You're working on your own. You're your own boss. You set your own schedules. You charge the patients what you want. Now, there's two ways this could go. Let me tell you. One way, you can partner up with a doctor and you draw that doctor's labs, and then they give you requisition forms, everything. There's another way where you just go to your patient. They call you and say, hey, I don't want to go to the lab. Okay, come over to my house. And you're like, bet, do you have a lab order? I do. Okay, what are the orders? They tell you, well, it says a CBC. Okay, let me see. I got lavender too. And then they said a CMP lipid. I got an SST. All right, yeah, I'll be right over. $300. Or if they have a kit, that too. You're collecting for the kit. You take it where it needs to go. You drop it off. So that's the two ways that could work. Okay. So you either work with a doctor, or you do it on your own. But they have to have all the information that you need so that you can drop it off at the designated lab, so that insurance can properly process that. Okay. Now let's say you a little. Oh, you know what? I'm here in Florida, but I see there's an assignment in Washington. I'm gonna pack my bag up and become a traveling phlebotomist. So you see, there's so many different routes that you could take. Well, baby, the first thing is you gotta take that class. After you pass that class, you take your exam. After you take that exam, you get some experience, and then you venture out. There's even more to it. Let's say you've been in the field for at least 5 years or more, or you went the medical assistant route and you still have experience. Now you could do what I do. You become a phlebotomy instructor, and then you own your own business. You see where this is going? So please, if you want to become a phlebotomist, just know there's so many different routes that you could go. But the first thing you have to do is find a school that provides that phlebotomy course, which I do, hands-on training, which I do, provide the exam for you, which I do, and I help you pass the exam. Stop playing, okay? So if there's anybody that is located in my area, I'm in Florida, and you would like some hands-on practice, and you feel like you need a bit of a refresher, I got you. Send me a message. But this is really the blueprint of phlebotomy. Like, it's amazing. It's amazing of how many things that you can do to get where you want to get. So, and then you become the best at what you do, because that's the only thing that you do. That's the only thing that you do.